Study Session 8, Adjustment and Adjustment Disorder. Introduction. The way people behave, adapt, adjust, or cope with conflict, stress, problems, and other challenges of life varies from one individual to another. While some people overcome their problems as quickly as possible, others spend more time in overcoming them. In this study session, you will be exposed to adjustment and the use adjustment continuum to explain how a well-adjusted person is quite different from a maladjusted person. Some adjustment disorders will also be explored. Learning outcomes. When you have studied this study session, you should be able to 1. Use adjustment continuum to categorize people in the society. Point out the features of adjustment disorders. 1. Adjustment and adjustment continuum. In psychology, adjustment implies adaptation, especially behavioral adaptation to a particular environment or set of circumstances. Coleman, 2003. According to him, a continuum is continuous sequence or dimensions in which adjacent points are not noticeably different, but the extremes are clearly different. Therefore, adjustment continuum is a dimension or a straight line having two extremes, positive and negative extremes, that can be used to explain the behavior of a well-adjusted person and maladjusted person. The adjustment continuum, therefore, helps us to distinguish normal or well-adjusted persons from abnormal or maladjusted individuals. At the extreme negative end of the continuum are those individuals who are so burdened with stress and resulted into various defense mechanisms. Example, denial, displacement, apathy, etc., which are helpless to deal with reality. These groups of people are psychotic individuals who may engage in highly maladaptive behaviors or violent acts. Next to them are the neurotics. Most people are at the middle of the continuum. At the extreme positive end of the continuum are the normal, well-adjusted, healthy, and self-actualized persons who always engage themselves in highly adaptive behaviors. An illustration of the three categories of people is given in the figure below. Adjustment continuum. Negative and positive. Psychotics, neurotics, most people well adjusted. Maladjusted, mentally individuals, negative. Positive, individuals, healthy persons. Negative, mentally ill persons. Positive, self-actualized persons. Negative, highly maladaptive behaviors. Positive, highly adaptive behaviors. Adjustment disorders. Adjustment disorder refers to emotional disability occurring in response to an identifiable stressful event, such as divorce or loss of a job. Meyer and Salmon, 1984. It is a maladaptive response of no more than 6 months duration to a specific psychosocial stressor, such as divorce or loss of a job. Zaid and Gray, 2001. The response occurs within 3 months of the onset of the stressor event and impairs life functioning. According to Coleman, 2003, adjustment disorder is a mental disorder, the essential feature of which is the development of clinically significant emotional or behavioral symptoms as a reaction to an identifiable psychosocial stressor, such as termination, marital difficulties, a natural disaster, failing to attain an important goal, or becoming unemployed, involving greater distress than would normally be expected from the stressor and significant impairment in social, occupational, or academic functioning. Although adjustment disorders are not effective illness, they are commonly associated with affective symptoms. Therefore, they are marked by mood alteration, anxiety, or depression produced by the interaction of psychosocial stressors and the individual's adaptive characteristics. Study session summary. In this study session, we discuss the way people adjust or cope with conflict, stress, and other challenges of life and how it varied from one person to another. Adjustment is behavioral adaptation to a particular environment or set of circumstances. We noted adjustment disorders as emotional disabilities which occur as a response or reaction to identifiable stressful events. End of study session 8. Thank you for listening.